Hello again, welcome to another of these tutorials. Unfortunately I've had to make number 2 in this series of muscles on the shoulder as I overrun in the first one where I covered the muscles deltoid and trapezius, and I covered them together because they form the contour of the shoulder and they have common sites of origin and insertion. So now we're going to move on and cover the other two which I was going to pair together, and that's Pectoralis Major and Latissimus dorsi. One is very much anterior, the other is posterior. They're still relatively superficial and they do form part of the axilla as well. And it's also useful to group these two together because they have a common insertion point, and that is important for some of the functions that they share. So let's move on and deal with Pectoralis Major first of all. So let's just put Pec Major at the top to remind us what we're dealing with. And we can say that this is the largest muscle and the most superficial muscle of the anterior wall of the axilla, but its origin is really down to its two heads. So it's got two heads. One, it's got a clavicular head, and secondly it has a sternocostal head. And actually, if you know a little bit about the anatomy, you'll be able to, the name actually gives away where they are originating from. In terms of the clavicular head, yes, it's the clavicle, but to be more specific than that, it's actually the anterior surface of the medial half of the clavicle, but clavicle will do. Sternocostal, well, of course, that comes from the sternum, as you might expect. And there's also a number of other structures which it comes from. It's attached to the first 7 ribs. Also, we have part of the 6th rib. And when I say the first 7 ribs, I should really say that it's the costal cartilages of those. That's the costal cartilage of those 7 ribs. And both of these heads insert, so insertion, they insert onto part of the humerus, which is the upper arm, and there's a particular name for that called the Intertubercular Sulcus. Sulcus. So sulcus is really just a depression, and this is actually in between the tubercles, which are there as a greater and lesser tubercle, and I'll show you exactly where that is when we look at a diagram in a moment, but the name does give it away. So once you start to learn this anatomical terminology, hopefully you can fathom out exactly where we're talking on any given structure. Okay, we must just quickly mention the functions, so we'll put these in a different colour, we'll use blue for that. So what can this muscle do? Well, it can offer flexion, it can adduct, bringing the arm back to the midline, so flexion of the humerus, adduction of the humerus, and offer up medial rotation because of the position of its attachment to this intratubercular sulcus. So medial rotation, turning the arm medially towards the midline of the body. And of course this is in the arm, but this is all at the glenohumeral joint, which is the shoulder joint. Individually, the clavicular head and the sternocostal head can have independent movements. The clavicular head, due to its position, can flex the arm from an extremely extended position. So if the arm is extended backwards, it's useful muscle to flex from an extremely extended position. The sternocostal head, working on its own, can offer extension of the very or extremely flexed arm. So we must remember that they have individual actions as well, but together it's the ones in blue at the bottom, which is the general functions that it has. It's also worth pointing out the innervation of this particular muscle as well. We'll just briefly say that the innervation is the medial and lateral pectoral nerves, which is C5 and C6, and also for the sternal head including C6, C7, C8 and T1. Okay, what I want to do now is, having had a brief overview, we can move on and actually have a look at this diagram. In this diagram you'll see that we've got an anterior view of the thorax. We can see that some structures are labelled. The clavicle is labelled, the scapula is labelled and also shown in yellow. We've got the humerus here, which we can label H. We've got the manubrium of the sternum here. We've got the body and the xiphoid process here of the sternum. And you can see the ribs going sequentially down, and you can also see the costal cartilages, which I'll just colour briefly in green just to show you where they are. So let's clear away the labelling. It's also probably worth me mentioning, I was talking about the Intertubercular Sulcus. It's probably worth pointing out exactly where that is now. We need to go to the humerus for this. So we've got a greater tubercle of the humerus and we've got a lesser tubercle here, and the intertubercular sulcus is actually going to run somewhere in between the two, and that's going to run roughly down here. There's an intratubercular groove in there, tubercular groove, and the sulcus is just a little bit further down around the area here of the surgical neck, which is roughly in here. So that's just showing you where the insertion point is of both of the muscles we're talking about in this tutorial, but starting off with Pectoralis Major. So let's just clear that away, and we can begin then to draw on the position of Pectoralis Major with its clavicular head and its sternocostal head. So let's begin with the clavicular head. The clavicular head attaches to the anterior surface of the medial half of the clavicle. So we can draw a line across here like this, and it's going to insert down onto this intertubercular sulcus roughly here. Don't have to be especially precise. And see, I'm going to do that again with a different colour. Let's draw it on in green. And where I'm drawing this green outline and the fibres like this would be the position of the clavicular head. Let's change colour and go for the sternocostal head. So here we've got to think about its attachments, and first of all we can say, well, it's the anterior surface of the sternum and the first 7 costal cartilages. So here it's attached to the sternum. It's also going to be attached to the first 7 costal cartilage. So there's 1. Oops, let's just put that back. There's 1 there, 2, 3, 4, 5, 6, 7. So we're going to have attachments down here as well. And from there we're going to get an attachment specifically to the 6th rib. So if we go, let's just label these down. 1, 2, 3, 4, 5, 6. And down as far as 7. So we're going to get attachment here. It's going to come down as far as the 7th rib. And again it's going to go up to this intertubercular sulcus, which is this blue landmark on the humerus, and that's where we're going to get our fibres and the direction of those fibres of the sternocostal head. So they are the attachments. Hopefully you can see exactly how that's going to offer up flexion of the arm. So it's going to flex the arm like this. You can immediately rotate the arm in this direction and of course bring it right in to adduct the arm, which are the main functions. Right, let's move on now and deal with the second of these 2 muscles, and that is of course latissimus dorsi. So I'm going to put lat dorsi as it's often referred up in the corner, and we're going to do a similar thing by talking through the origins and insertions and function and innervation of this muscle. So as far as lat dorsi is concerned, we can say that it is the lateral and posterior wall of the axilla. Its origin is the spinous processes, so the SPs, that's the spinous processes of the vertebrae, the bit that sticks out the back of the lower 6th thoracic vertebrae. Just put vert for short. Also, it attaches to some fascia fascia you probably haven't learned about yet, and that's called the thoracodorsal or lumbar fascia. And fascia for now can just mean to you guys connective tissue, surrounding connective tissue of the muscle compartments. That'll be fine for now. It also attaches to the spinous processes of the lumbar vertebrae as well, and also to the iliac crest of the pelvis too. And one last thing, which is the lower 3 to 4 ribs as well. So it's quite a number of points of origin. The key ones here. There's 1, 2, 3, 4, 5. The insertion. Let's go back to black here. Insertion is onto the Intertubercular Sulcus. Slight difference with the position of the intertubercular sulcus. Same structure, but this is actually on the floor of that sulcus, which is compared to Pec Major, which was the lateral lip. Now that's quite specific, but in some ways important because it does show you that they have slightly different functions. They have some overlapping functions, but they also have slightly different functions as well. So what about some of those functions? Well, as I said, some of them overlap. We get adduction, so we'll do that in blue here. We get adduction. We also get medial rotation, 2. We get extension of the arm this time, not flexion. So we get extension of the arm at the glenohumeral joint as well. It's also worth mentioning at this point the innervation, and the innervation to the lat dorsi muscle is the thoracodorsal nerve, which is C6, C7 and C8. So let's now have a look at a diagram where we can have a look at these attachments. So let's just have a look at this diagram and point out some of the things we're looking at. We can see vertebrae in here. We can see some ribs in here. This is highlighting particularly the structures which have a connection with lat dorsi. You can see the muscle of lat dorsi in pink. You can see these overlying red parts to the muscle which show attachments. We've got the pelvis here as well, scapula up here, and this is the humerus of course here, and we've got the sacrum down here as well, and you can see that it's labelled with the 12th rib. So let's just clear that away and let's have a look at some of these attachments. So we have, let's just mark these on, we have here we have the attachment of to the spinous processes of the lower 6 costal cartilages. We also have spinous processes attaching here to the lumbar vertebrae as well, also the SPs, the spinous processes. So here we've got via the thoracolumbar fascia, which is some connective tissue, as I mentioned before, but the spinous processes of the lumbar vertebrae and also the associated ligaments of those spinous processes as well. We also have attachment here to the iliac crest. So we have that as well, and we also have in here, which is the lower 3 to 4 ribs as well. In this case it's 4 ribs, and you can see that at this point here where the muscle reaches up to attach to this point on the humerus, which is the intertubercular sulcus, and particularly there's the floor of it, we have a 180 degree angle change here showing how the fibres actually twist 180 degrees before they attach. And what that means is that the fibres that are down here, that I'm marking in green, at the lowest point of attachment of those fibres of lat dorsi have the highest point of insertion onto the humerus, and likewise those that have the highest point of origin of the muscle have the lowest point of insertion, which is for strength. And there we can see the overall attachments of the lat dorsi to the humerus at the intertubercular sulcus, and hopefully you can see how it takes part in some important movements. You can see how it would involve itself in extension. Yes, it can still involve itself into medial rotation and adduction. And the subtlety here is the extension and flexion difference between Pectoralis Major and lat dorsi, and that's because of the position of attachment to the intertubercular sulcus. So that pretty much summarises everything I want to say about these superficial muscles around the shoulder. I hope that's been useful. See you next time.